All right. Good afternoon, everyone, and welcome to our November Learning Forum. I am going to continue to admit folks, and I will turn it over to Jill for intros and welcome.
Well, good afternoon, everyone. Happy Thanksgiving week. I hope you all are having a good holiday week. My name is Jill Nelson, and I am filling in for Tara and Carrie this afternoon. Tara will be joining us here shortly. My name is Jill Nelson, and I am the Maternal and Perinatal Initiatives Consultant in the Bureau of Family Health at KPQC. Within my role, I oversee the Kansas Perinatal Quality Collaborative. So I work very closely with Tara and Carrie, and then I am also the coordinator for our Kansas Maternal Mortality Review Committee. So it is nice to be with all of you today. We have just a few slides here at the beginning, and then I will turn it over to our presenter. So at the top of our list is that the fourth trimester initiative is officially complete as of the end of October. Tara and Carrie will be reaching out to you all early in January after the first of the year just to get your final birth numbers for 2024 so that we can enter in our final data for that AIM bundle, and we can wrap that up and get ready to go with our new one. We also wanted to give a shout out. We like to highlight the amazing work that you all are doing day in and day out. And so we wanted to give a shout out to Cassidy Dolzer and the Clay County Medical Center team. This window cling that you see here is something that their organization instituted. This is in their ER registration area and really is tackling that question about we want to make sure that we are asking whether or not someone has been pregnant within the last year or is currently pregnant so that we can provide the best care. So we just wanted to give them a shout out. This is a great graphic and an easy way to just kind of give the patients an understanding of why we're asking this question and why it is important. It's because we want to help take the best care of them. So thank you to Clay County for sharing with us. Very exciting. Next slide, please. So, as I said, fourth trimester is officially wrapping up, and we will be entering our final data here the first part of January. But I wanted to alert all of you fourth trimester champions that the enrollment packet will be sent to you on January 6th for our next AIM bundle, which we are focused on severe hypertension in pregnancy. And as we've mentioned several times, a lot of the elements that we've already set forth with the fourth trimester initiative are going to continue on. And of course, breastfeeding is one of those core components, which is why we have our topic today. We have chosen that although we are focused on a maternal initiative in the inpatient setting, we also wanted to focus on a neonatal initiative as well. And so breastfeeding is going to continue to be a core component of our next bundle moving forward. Next slide, please. And then Carrie had just wanted to highlight this article that came out from the JAMA network here in November that unfortunately has highlighted that homicide is the leading cause of maternal death in the United States. And pregnant women who have given birth in the past year are more likely to be murdered than to die from medical causes such as preeclampsia or hemorrhage. And it's important, of course, because we know that divorce laws and access to reproductive care with individuals that are less than 25 years and Black women are at the highest risk. So, and of course, unfortunately, intimate partners usually account for the largest proportion of pregnancy-associated homicides. So this is an article that we just thought was important to highlight for you all. I'm sure that we can probably send the link to this article out in our follow-up email. So we'll make sure that you receive that as well. Next slide, please. All right, and to get to the topic at hand today. So I am so thrilled to introduce to you Dana Dieters. Dana is a Washburn University graduate. She has worked as a critical access hospital nurse for over 20 years at the Nemaha Valley Community Hospital in Seneca. Since she has worked there, she has cared for patients ranging from newborn to elderly. For over 18 years, she has been the OB supervisor as well. She is an international board certified lactation consultant and a child passenger seat technician. She helps moms through the entire pregnancy, ranging from childbirth classes to delivery to follow up care in the breastfeeding clinic. She is also active with the Kansas Breastfeeding Coalition and is the current hospital section chair. So, with that, I'm going to turn it over to Dana. Thank you so much.
Yes, thank you for that wonderful introduction. It wears me out just thinking of all of the hats that I do. And so, just to start out with the Kansas Breastfeeding Coalition, for those that are not actively involved with the breastfeeding portions of their OB care, um, it is a very, very vital organization in our state helping our mothers. And so we have multiple sections, and I'll talk more about that later on as well. But just so you can see, we do have stuff out there beyond just hospitals. We're looking at childcare, public health, and even local breastfeeding coalitions. And so it's just a very vital organization out there, focusing specifically on breastfeeding and how we can help our mothers. Next slide, please. So, just to kind of go over the amazing things that are going on in our state, and what the breastfeeding rates are in the United States versus where we are in Kansas, and even what the healthy people goals are for 2030, and to see where we are. And I think we do a very phenomenal job with initiation. But you can see there's a dramatic drop once we hit 3 months. And what a lot of moms take a 12-week maternity leave, and yep, it drops because we're going back to work and we don't have the support in our jobs and all of that to help these moms with this. And even as we get further out, it drops. And so we need to try to figure out how to help these moms long term with their breastfeeding. Next slide, please. This is kind of the breastfeeding rates over the last um, 10 years. It shows from 2011 to 2021. And it just kind of reiterates the fact that initiation is great. And long term, though, has been dropping off, or that where it is. But you can also see, though, as we've been doing our work, where it's was and where it's going, that we're making strides. It just takes time to get everybody on board with those breastfeeding rates. But hopefully we can keep improving on those numbers. Next slide, please. So we need to celebrate. We need to celebrate all of the good things that's going on out there. We are fourth in the nation for rates of infants exclusively breastfeeding at 3 months. And I think that is top notch. And that we even continuing on thinking about the rates for breastfeeding at 6 months, and that we're fifth in the nation. So we are doing great things here. We just want to keep building on that and improving. And that's just everything that we're doing for these moms and babies. Next slide, please. So now, if you take a look at this slide, I know it's a lot of different numbers and everything that goes on, but look at what the rates are for your county for the initiation of breastfeeding. And I think sometimes it can be eye-opening. And I often wonder, I look at Donovan County and what their rates are, and I think, okay, where's their lactation support? They don't have a hospital that delivers there. And so, what are they getting? How far do they have to travel for that lactation support? And where that vital information is, and do they know where to go? Can they go back to where they delivered? We want to make sure that these moms have all of that support, and it is very challenging. But I'm also quite impressed with when you look out at Western Kansas, there's a lot of initiation of breastfeeding. So what's going well out there? How are they helping those moms as a general and as a whole? Next slide, please. So, how does this relate to our fourth trimester initiative? When I think back and I look at where this initiative started, I think of all of these different little things that we have been building on in these last couple years with this initiative. We have been working on so much education that we can give out to our patients, getting them the post-birth warning signs, looking for screenings. Are we doing mental health screenings? Are we looking for signs of abuse and helping those moms with all of that? What is the support? Are we making sure that there are follow-up visits scheduled? What are we doing for these moms to make sure things are going well? And I think that, you know, all of that comes together and that empowers us to help our patients, and it empowers the patients to let them know, okay, these are the signs and symptoms for post-birth. This is what I need to follow up with. Okay, these nurses have been talking to me about postpartum depression and what to be looking for. And so, we're giving them that support. These moms are empowered, we're empowered, and we're more comfortable. I think back when we started doing all of the training with the mental health and substance abuse screenings and everything, and it made me feel more comfortable and confident to go in and talk to these moms. So then we're missing this part of, okay, we're talking about fourth trimester initiative, but where's another part of that? And that's breastfeeding. And that plays so much into what our maternal mental health is. If breastfeeding isn't going well, these moms will blame themselves. And so we need to be out there supporting the breastfeeding as well. Um, it's all like what we've looked at, that big flower with the petals, and each part is vitally important to our mothers. Next slide, please. So, throw in the Kansas Breastfeeding Coalition, and what did we do to help these moms? I was going back and trying to look through old emails and think about how far back did we start working on these cards. And I want to say June of 2023, somewhere in there, I started seeing emails about it. And it took a lot of back and forth, a lot of work between us. We had partners with KDHE. I think Tara was maybe involved. There was a lot of eyes looking at these cards. And so these cards are a testament to what everybody worked on to try to help our mothers on the breastfeeding side of things, on the baby care side of things. And so these cards complement the post-birth warning signs cards that we've gotten and that we give out to our moms. Well, these turn around and do the exact same thing for the baby. And so it's a double-sided card, and it's going through and showing, all right, these are warning signs that we need to follow up with our baby medically. And these are things that we know breastfeeding is going good. And so we're giving them that breastfeeding support and telling them when to follow up, and that newborn support and telling them when to follow up. So next slide, please. So here you go. Here is one side of this wonderful card. There was lots of back and forth on things, but as you start to look at this card, I think it all starts to make sense. These are medical signs that we're telling these moms to follow up with. When do we need to go to the emergency room? When do we need to call just the doctor and talk to them? And so, we're going through things, as you can see, the temperature, bleeding issues, if there's a circumcision or anything like that, breathing issues. That's a big thing. I think some parents, especially first time moms and dads, they go home, well, how do I know? I see every single patient come back into my breastfeeding clinic for those follow-up visits, and things that I commonly hear, oh, they sneeze a lot. Oh, they get the hiccups a lot. What is normal? And so being able to be like, okay, these are the breathing issues that we really need to be concerned about right away. And then as far as just calling and following up, we all know breastfed babies, they all have different bowel movements. Some will have a stool every feeding and some won't have a stool for several days. And so discussing, okay, what is normal for that breastfed baby and where do we follow up? We know in those first few days, those babies are at higher risk for jaundice. We're waiting for that milk to come in. So how many diapers do we have a day? How do we know if this baby is hydrated? And so this delineates those things out. This talks about, we have information in there about behavior as well. So where do we delineate this baby is fussy and this is normal, and is this excessive and we need to follow up. And then also on that card, as you can see at the bottom, there is a QR code. And so that is going to give you a link or give that mom a link at home that they can get to more information on baby care and get them to trusted resources and everything, so that, okay, I'm at home, it's 2 in the morning, I'm kind of scared to call somebody right now. Maybe this would give them a little bit more information or guide them into, I need to follow up right now with my baby and get them to the ER. And so I think that this does a really good job of delineating all of those things out. Just like the post-birth, I can sit there almost now and go in verbatim and tell those moms all of the post-birth things when I'm doing their postpartum teaching with them and saying, okay, here's where you follow up. These are very important key things. And so now I can hand them this and be the same way. Okay, this makes it cut and dry for me as a nurse to walk into the room and be like, here's the most important things. I know we're going to give you this whole big booklet of papers and things to say, oh, follow up with this. This is normal. This isn't normal. But at 2 in the morning, it is nice to just be able to pull this card out and be like, okay, I need to go to the emergency room. I need to get my baby to the ER right now. Or I can call the doctor in the morning about this and report this off. So go to the next slide, please. So now with the breastfeeding things, we do need to make sure that these breastfeeding things are going well, the baby is feeding well. And so this delineates out kind of, okay, where do I go out and get help? And what's a warning sign? And so, we're looking at, okay, are we showing signs of mastitis? Because that's something that we do need to get treatment for right away. Not that you have to call an ambulance and like rush right into the ER, but we need to be calling somebody and getting that antibiotic going because we don't want moms to get abscesses and even worse infections. And so we need moms to know that this isn't normal. These are things that we need to follow up with. But then it also goes into our caution signs. Are we feeding effectively? Are we dealing with sore nipples? And then are we getting lumps or bumps? Or are we getting issues like that, that baby's not removing milk effectively? Then we need to call and find that lactation help, find somebody. And I feel like that's very important. And so there is a QR code there that you can get, and that if I remember right, that takes you right to the Kansas Breastfeeding Coalition, and they have a whole list. They have a wonderful map delineated out, with here's places throughout the state of Kansas where you can get that breastfeeding help. That's people, whether it's health departments or hospitals, places that have lactation support people there so that those moms can get that help. Because we know that when we look at mom's maternal health, mental health, you also feel like if breastfeeding doesn't go good, then they blame themselves and they think that they are at fault. And so that then further makes them depressed and they sometimes have a lot of issues dealing with that. So if we can help those moms get the feeding going well, that empowers them and that helps their mental health so much more. So then we have also, then the next section goes into the going well signs. And so this really just discusses the fact of, okay, we need to be feeding our baby 8 to 12 times in that 24-hour time frame to make sure that baby's gaining weight appropriately, to make sure that mom's removing milk effectively and enough times to maintain her supply so that she's making enough. Because if you've ever breastfed, you know that it is supply and demand. And so if we are not feeding those babies effectively, then that supply isn't always going to be there the way we would want it to be there. And then it also talks about, okay, where are we in days of life, because we know that in the very beginning, those breastfed babies don't always pee and poo a lot. And so, okay, by such and such a day, we need to be changing this many diapers. We need to be regaining birth weight by the 2-week checkup, and everything. And then it also talks about what mama should be feeling, because I feel like sometimes we get so busy doing all of the things and we're trying to just get the baby latched on. And maybe we need to remind them that, okay, your baby is nursing good when you're feeling that uterine cramping. But it doesn't always mean that you're going to feel it every time, but that it's a normal feeling, and reassure them with that, and tell them how they can treat that discomfort, and those ideas of how long it will last. But knowing that that cramping with the breastfeeding is a good sign. And then what the breastfeeding should feel like, and how moms should be feeling after they're done breastfeeding. There's also some good information in there at the bottom you can see on hand expression. Sometimes that helps moms more than anything to get that baby to latch on. And sometimes moms can remove milk more effectively using hand expression than by using any breast pump. And so they need to know that, so that they can also be able to remove milk that way, or to perhaps get the flow started so that when they get baby latched on, baby's getting some milk or colostrum. There's also on this also a QR code that is going to guide the mom to more information about hand expression. So they can find videos online of how to correctly hand express that milk. But as you can see, seeing both sides of those cards, like, I feel so good walking into that mom's room and holding up that post-birth warning signs card and those magnets, and being able to go through and be like, okay, this is how you take care of yourself physically, but then to also hold up this card and to be like, okay, this is how you can take care of your baby. This is what you need to follow up with your baby and be concerned about. This is how you breastfeed your baby, and where you need to be concerned if feeding isn't going well, or where you can go get that help. Where is the nearest lactation support person? And so, these moms, when they look at those cards, it's kind of almost like this eye-opening moment, I feel like, that, okay, this is more like very important and cut and dry, because we know mom's overwhelmed with everything. And so this just hones it all in. And so hopefully you guys can all see how these cards are helpful, and start to utilize them, when you're taking care of your patients. If you haven't already, I know that there are a lot of facilities on here that are part of the Kansas Breastfeeding Coalition. And so they may already be giving these cards out, and that's perfect and wonderful. But if you aren't, they're here for the taking, and very helpful to our moms. Next slide, please. So, if you have not gone to the Kansas Breastfeeding Coalition, my goodness, you are missing out. If you have not heard of it, if you have not been involved with it, please, please, please go look, go entertain yourself. Go look at that. And really, if nobody in your facility is involved with the Kansas Breastfeeding Coalition, get involved. Be that breastfeeding advocate for that mother. And honestly, this organization is beyond just taking care of the moms and babies. If you kind of look at some of these signs up here, they're also helping employers, talking about how you are assisting your staff members in breastfeeding. And that way, you know, places of business are getting recognized for being breastfeeding friendly for their staff, and knowing what the lactation rights are in a workplace. And so not only, for you to be able to tell your parents to be like, hey, when you go out to go back to work and they're telling you you need to go pump in a bathroom, no. You need to be able to say, I have a right to have a clean place to be able to get my food for my baby, and know that it's the law. Even just not even just workplace, knowing that it's a law that you can breastfeed your baby wherever you want to. And so that we can support these moms, support them when they go back to work so that they know that. Have your business be supportive to breastfeeding, making sure that you are setting things up so that your staff members, your coworkers, yourself, that you have the right place to be able to pump and have those resources available. So any of these things that you see up there, they are things that you can order and you can get to be able to give out to your moms, to be able to go back to your boss and say, hey, we should be kind of doing this to help support even our staff that, they have the right place to be able to go breastfeed or to pump and to store their milk safely until they are able to go back home. So please feel free to go look at this website. I would say all of these things are all free for the taking. The only thing that the Kansas Breastfeeding Coalition charges for is to help with the shipping, because we know that the shipping costs are crazy out there in our world. But when you think about the multitude of things that, once you go there, you'll be able to see there are a lot of things that you can get to give to your parents so that they have that support. There's also a lot of resources on there that are in Spanish because we know that across the state of Kansas, we have Spanish speaking population. And so that way, when those moms come in, then, we can give them these same exact resources, but in a language that they understand. Because those moms need the support more than the rest of us. Because I don't know about you, but when I have a Spanish speaking mom come in, there's definitely a language barrier. And so you're trying to deal with all of that, but to be able to hand them these trusted handouts that they have, that they can go home and they can read in their own language is, um, very vital to them and to their, to help them to be able to care for their baby safely and to know what those warning signs are, to know what their rights are for breastfeeding. And so lots of good things on this website. Next slide, please. Also now, this is a new thing that's popping up. Notice how we have all the QR codes. It makes everything so great to be able to get directly to the information because we know surfing on the web can get you to all kinds of crazy places. So we've got these great QR codes that will take you to many places. This is a virtual to-go bag. So when you scan this, you're going to be impressed. It's going to get you to all kinds of different trusted sites that you can guide your moms to. You can go look up information. And so it is a great asset to be able to use this. And it just saves a lot of the digging around and trying to find the right information for those mothers. Um, so next slide, please. All right. So as we go out and support our moms, if you are a facility that doesn't have any lactation support people, since I put this slide up here, I have heard that this class is filling up fast. The last I heard, there are only 7 seats left. But this can get you to get a staff member to get some enhanced breastfeeding training. And so what it's going to do is it's going to take you to a place that you can log in and you can get this discounted rate to be able to get a staff member or yourself to be a certified breastfeeding specialist. The classes are through Lactation Education Resources. It's all online and it can be completed on your own time. Obviously, you'll need to get those classes done before June of 2025 because there will be an in-person session to go over skills. Um, but I went to the same website and did my online training portion for my IBCLC certification, and it was great. And I felt like, oh my gosh, it was almost overwhelming because, yes, it's a lot of credit hours. It's a lot of time sitting there in front of the computer, but to understand that breastfeeding more, to understand how it works, understand challenges with breastfeeding. It just opened my eyes to broader things and to understand breastfeeding in general so much more. And so with this, we're wanting to be able to get more people out there to do that IBCLC. It's a lot of work. And so we need our helpers because there's only so many IBCLCs in the state of Kansas. And so we need more people that are having that breastfeeding training. So if I can get a staff nurse to take it, then maybe it's somebody on the night shift that at 2 in the morning, when we have these babies cluster feeding and that mom is exhausted, that nurse can be able to support her better so that she can get through those challenging times and everything. And so we can have more people knowing how to help a mom better with latch. And well, we've got sore nipples. What are we doing? And so, like I said, it's a very limited amount of seats because they are filling up quickly. And so, if you are interested, or you know somebody that would be interested, here is your chance to hopefully try to slide in there and get some extra breastfeeding training. Next slide, please. So, on the flip side of things, for the last how many years, our facilities have been out there across the state of Kansas, ones that have had lactation help, and we have not been able to bill for anything. Well, guess what? We are able to build. And we have been actually over the last over a year now, I think, there have been calls going on through the Kansas Breastfeeding Coalition that we have a billing cohort call. And it alternates between local health departments and the hospitals. So we can figure out how we can bill for these services that we are doing because it's very vital to these moms and it's a lot of work for us to be coming in and doing these services. And so these calls, if you're interested, you can reach out to myself and I could get you hooked up with Brenda Bandy, or she's actually on the call right now as well. And you can get involved in these billing calls. It's been very eye-opening to me because I think as healthcare providers and nurses, I don't know what goes on the back end with the billing. I just say, okay, here, I did this. And then these magic little elves create this bill and voila, it's there. And so for me to start seeing more of this stuff and to know, okay, well, if we're doing this, we can bill with this code and to try to help in the process of building charge codes. It's been very eye-opening. But I hope in the end, if we can start saying, okay, we're getting some money back from this, that maybe more facilities would be more hands-on to be like, okay, this might be more of a feasible thing we can do if we can get some money back from these services, that we might be able to expand that to allow more lactation help for our patients. So next year, there will be coming out a lactation billing manual to help, and it's going to have what we have been discussing in these calls. Okay, this billing code has worked well for here for this insurance. This billing code works better for this insurance. Because we know insurance, it's all a game of trying to figure out how to do that billing. And we know that we want to try to get every dollar possible so that we can, you know, continue to offer that lactation support and to keep these things out and going. So next slide. So back to the KBC and the sections. You all are definitely more than welcome to join us. As you can see, we have multiple sections. The hospital section, we focus on all kinds of things. Our last call we just had last week, very eye-opening, very good conversations on human donor milk and how even for the smallest critical access hospital, can we offer human donor milk to those babies if mom is struggling with breastfeeding, or we have a low blood sugar and we need to get some calories into mom and the colostrum just isn't cutting it when we're nursing at the breast, that we can get them the milk as opposed to offering formula because we know how important that breast milk is to those babies. And that if we can get that going, so much better for those babies. There is a lactation billing cohort. If you are anything involved with public health, there's the public health section. And so that's good. We actually, I do talk to my local health department ladies once in a while because we have the Healthy Start home visitor programs with the health departments. And so they have lactation support people there. So they're out there in the communities wanting to help these moms. And then the local breastfeeding coalitions. So some areas in the state break down into even smaller little coalitions and groups that work on things just for that territory, that this is more what's going on. Um, and there's also, if you have kids in daycare, I saw a local daycare provider not too long ago, and I was like, hey, you get these moms bringing in that breast milk. Um, here's how you can support that mom if she's breastfeeding. And actually, she talked about that, and she was very supportive of the breastfeeding. She didn't know that the KBC was out there, but I was impressed. She said that she had a mother that that baby was very particular about taking a bottle and very attached to mama, and that mom would go on her break to go feed her baby. And so, knowing that there's those supports out there for those moms to continue to breastfeed, very, very important. So please reach out if you are interested in joining the hospital section. And, we are happy to have you. All of the ideas out there, the better to support our mothers. Next slide, please. All right. I would be remiss if I was not to recognize Brenda Bandy. She's very vital to this organization, and very supportive to the moms. I'm always amazed at seeing how she's out here, going here, there, everywhere. She's the executive director for the Kansas Breastfeeding Coalition, and she is a rock star for our breastfeeding moms, in multiple levels across the state of Kansas. And so just have to recognize you, Brenda. Thank you for all you do for the Kansas Breastfeeding Coalition and for our mothers. Next slide, please. So, for any breastfeeding resources and questions, you can email this email address, and you can get somebody to respond back and to help you, to be able to help figure out what we can do in your facility to help support these moms. Um, I jokingly say when these moms come in to see me for the breastfeeding help, this chair back behind here, it is that therapy chair. And the fact that I very much see how maternal mental health is very much intertwined when we're struggling with breastfeeding. The worry for these moms, the support that they need. And so we need to make sure that we're helping those moms. And it's very important in the hospital because those first few hours, those 24 hours that they are there with us, we need to make sure that those moms are ready to be able to go home and feed those babies. And we need to make sure that they have the follow-up support. It's great to make sure that they're going back in the clinic in those 2 to 3 days after they go home. But to get that breastfeeding help, they don't always see that in the clinic. And so, it's very important to make sure that they have somebody that they can go to for that lactation support as well, so that we can help support mom and baby physically, but also mentally. And so, yes, reach out if you have questions, if you want to be involved in our organization. Very much would love to have you all. So that is all I have.
Dana, that was awesome. You have a spunk to you that never stops. So huge thank you for all your work that you do. And your chair behind you isn't that chair needs a name, but also
It's
all
the therapy chair. That's what I call it.
because it is. That's exactly right.
It definitely is. I will tell you that in my support, I have had moms sit here for 2 hours
Yeah.
needing help. And so
Yeah.
that's why I think it's important to make sure that there is lactation help out there for those moms.
1000%. And I think it's a wraparound services, Dana, that you're able to do in your community, as well as what you have made the new dynamic at your facility. And that's really what this is about. I don't know how everybody else is doing, but is it the holiday week or is it a holiday week? What is happening? There's not even a full moon, Dana. Anyway, so thanks, Jill, for jumping on when Carrie and I were called other places. But I just want to wrap up. We're going to give some time back to everybody today. Yeah, you too, Jackie. But hear us say that we're excited to get data tightened up. Jill mentioned that we're going to present that to you so that you have nice polished data to show off for your facilities if you're a 4-trimester facility. We're seeing some great things as we look back over the last 3 years, and we're so proud of everybody. You're doing great stuff. And then of course to launch and do a full launch into this initiative that many of you are already doing pieces and parts or maybe all of already. But in the middle of that, you're taking care of patients. You have a chair of counseling in your office. You're being called to a stat C-section. You're answering the call at home. You're taking care of your elderly parents. Like, we get it. And so just hear us say that at the end of the year here, we're so thankful to all of you for doing the hard work for moms, families, babies, everybody. So we'll see you in January with the next Learning Forum. Expect to hear lots of emails from us, you guys. We need lots of data from you heading into the last part of the year, including your birth numbers. So count all them babies, and we'll be in touch ASAP. Happy Thanksgiving, everybody.